This is a test. This is a trial. This is an experiment to push myself and my creativity. While this video may seem average or may not be unique, to me it means change. My name is Andy and this is Andy Vlogs. Do I have anxiety? That is a question I have asked myself many times in the last 2 years. To be honest, I don't know. In this video, I will be talking about anxiety and a few interesting facts about it. I have found a few indicators or signs of anxiety, and I hope this will help you understand just a little bit more about the subject. I have been thinking about putting together a vlog on this topic for a few months now because I want to update you guys on a video I put out almost a year ago. In that video, I conceded to the fact that I had depression. But since then, I have read many articles and journals, and my self-diagnosis was incorrect. I want to preface this next segment by saying I am not medically trained. I am no doctor or nurse, so please only take this information with a grain of salt. Do not take my words as a medical diagnosis. Consult a doctor. If anything, please use this information as a springboard for your own research and interest on the subject. In the descriptions, I've actually put the citation for where I got my information. Recently, I found a cool yearly publication called BMJ, or British Medical Journal, on mental illness and more specifically GAD, or Generalized Anxiety Disorder. According to a clinical review in 2011 called Generalized Anxiety Disorder, Diagnosis and Treatment, GAD is pretty common among all people and has a 4 to 7% lifetime prevalence. It is the disorder of chronic uncontrollable worry, compounded by psychological symptoms such as disturbed sleep, muscle tension, and difficulty concentrating. What hits home to me is that GAD can go undiagnosed because of the focus on physical symptoms and because of the stigma of mental illness. To me, anxiety is uncomfortable, uncontrollable, and is unexpected. It is simply a sudden rush of panic and fear. It's like the feeling you get when you walk into class and realize you forgot to do the assignment that everyone is turning in. But that feeling comes at random or unexpected times throughout the day. Normally, that realization experience is what triggers those feelings, but for me, it happens without the catalyst. I can't say if this is true for all patients with GAD, but it happens to me and I hate it. According to the publication, to meet the definition of GAD, the patient must have chronic, uncontrollable worry and difficulty controlling anxiety about different events or activities. In addition to worry, patients must have at least 3 or 4 psychological arousal symptoms listed in the diagnostic criteria for GAD. Those diagnostic criteria include restlessness or feeling of keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance. As a side note, anxiety stemmed from medical disorders, concerns about personal safety, or by the use of drugs would actually not fit this qualification. In my opinion, the key word is chronic and excessive. All of us at one point or another in our lives will actually meet some, if not all, of those diagnostic criteria. That is why I said at the beginning to take this with a grain of salt. But for those who have noticed these symptoms for extended periods of time, or in excess as it's explained, I would highly recommend meeting with a physician. I also learned that unfortunately in the medical industry, there are a lot of misdiagnoses of GAD among doctors and physicians. In one case study, doctors only diagnosed true anxiety in 23% of patients, and 65% as true depression. In other studies, researchers found that among patients false diagnosed of depression, 27% of those patients actually had GAD. So in other words, doctors aren't fully capable of diagnosing correctly true anxiety or depression, And then among those who feel they have depression and are told they don't, more than a fourth of them actually have GAD. This is unfortunate and needs to change. There needs to be more of a focus on treatment and diagnosis of GAD. I know it is a new and unresearched disorder, but my feeling is that there is a lot of people out there struggling with it alone. Furthermore, doctors aren't sure how to fully treat the disorder. According to the article, some common practices among doctors for GAD treatment are the same as depression. Some of these treatment options include psychological therapy and even drugs. In the end, I hope that you found this video to be very insightful and interesting, as it was for me in my research. In my next video, I want to talk about my own personal coping strategies and treatment for anxiety. Please stay tuned and mash that like button if you enjoyed this material. Please subscribe if you want to see more. This is Andy Pauls with Andy Vlogs, signing out. Woo!